Medical intuition is the ability to sense and see inside the body, to communicate with the body as a whole, to communicate with organs and systems of the body, to find out what's out of balance. So you'd work on everything from the person's grounding, looking at their chakra system. You would look at the subtle bodies, so the aura around the body. You would look at the organs and systems of the body. So you can go anywhere when you're working as a medical intuitive. So you might end up doing work on the inner child. You might end up going into ancestral healing. You might find cords that need to be cut. Also, you can get programs, patterns, beliefs that people are running within their system. So if you have a pattern or a belief that says, I can't get sick because that's a weakness, then they will be running that in their system. So you might also find that there's attachments, etc., etc. So with medical intuition, you can start with the body and then end up really going anywhere. I'm not qualified to give medical diagnosis, only medical qualified doctor is able to do so. So when you're talking to somebody in terms of medical intuition, you have to be really careful about what you say. So often you will go from what they've said to you rather than give a diagnosis. So you have to describe things in terms of the symptoms, how it's manifesting, rather than actually come out with the diagnosis. So if I found a medical condition, what I'd have to do is refer the person back to a doctor or a medical practitioner. So if it was something neurological in this country, you might just say to them, okay, go and find a good neurologist because they need to, do a brain scan or something. If you say, there's something wrong in the head, yes? So if you go and see a neurologist, they will give you a brain scan. I'm not giving them anything other than there's something in your head. Yes, I'm not telling them you've got a brain tumour. I'm saying to them things like, well, it might, the manifestation of this is that you're probably getting headaches. Maybe it's interrupting the electrical impulses in the brain, etc., etc. Maybe you're seeing auras a bit like a migraine. So I would talk about the symptoms and the manifestation of, but without saying to them you've got a brain tumour, right frontal lobe. So how I would treat a medical condition is it depends what it is, how it is. Yes, so if it is something that is growing, that shouldn't be growing, then what I would do is I'd contain it in white light and I'd aim to help to shrink it and contain it so that I would work alongside the allopathic treatment that they might be having or should be having.